Okay, folks, it's 5 after 12, and in the interest of your schedules and moving along briskly, let's get started. Good afternoon. Welcome, everybody. My name is Perry Newman. I am the Executive Director of Konbit Sante, and we're very, very happy to have you join us today for this presentation on using research to improve health outcomes in the north of Haiti. Our featured presenter will be introduced shortly by my colleague, Tetsuta Nagusi. But I would like to take just a moment or two, in addition to welcoming you, to share a little bit of context and background information about Konbit Sante for those of you who may be less familiar with us than many of the others who are stalwarts or longtime supporters and participants in the work that Konbit Sante does. So with your indulgence, I'm going to make a very brief presentation, just as I say, to sort of set the table and provide some context. And we'll go through it quickly. As I say, that some of you may be well aware of this, but in the interest of all of us being on the same page, let's just start it this way if we may. Right. All right. So again, a very brief overview of Konbit Sante, strengthening healthcare systems in the north of Haiti in particular. So Konbit Sante's mission, as you can see, is to support the development of a sustainable health system to meet the needs of the Cap-Haitian community with maximum local direction and support. There's a lot embedded in this mission statement. Chief among the items are the notion of sustainability, the focus on the Cap-Haitian community, and of course the kind of the DNA of Konbit Sante, which is the maximum local direction and support aspect of our work. All of these things will become a little bit clearer as we move through. Okay, so just a little bit of a geographical context setting. You know that Haiti shares the island of Hispaniola with the Dominican Republic. You can see the capital, sort of Port-au-Prince, in the kind of the notch of that inverted letter C. A bit of further context, Port-au-Prince here, and we'll see in a moment that Cap-Haitian is all the way up here in the north, the Dominican, of course, to the east. Scoping in a little bit further, you see Port-au-Prince here and Cap-Haitian here, and I feel it's important to sort of set the geographical context because one hears so much about Haiti, most of it negative these days. Important to point out that Port-au-Prince is about 110, 120 miles from Cap-Haitian as the crow flies, and quite different in its atmosphere and in its ambiance, shall we say, politically at the moment. Haiti in the news, as I said, does not paint a pretty picture. These are obviously scenes taken, as we'll see, not from Cap-Haitian, but from Port-au-Prince and environs. And this, of course, is most what we like to think of as Cap-Haitian, and in fact, quite reminiscent of today's Cap-Haitian. Beautiful day and a beautiful view of the cathedral and environments. So a rather different environment in Cap-Haitian than in Port-au-Prince. Not without its challenges, of course, but those of you who have been to Cap-Haitian recognize the waterfront and a view from the lobby of a nice hotel on the waterfront. The feeling is quite different than one would encounter in Port-au-Prince. So our work involves our partnership with 4 hospitals and clinic, quite simply to improve healthcare outcomes for poor people. Our partner hospitals are serving Sante in the upper left-hand corner, the Justinian Hospital here, these 2 pictures. This is in the rear of our partner hospital serving Sante in Limbe. You can see it's quite picturesque here in the Justinian Hospital. And we also work with ULS, Unité de Lutte de Santé, and Force Michel, all in the northern part of the northern province or district. So how do we go about improving healthcare outcomes for the poor? Well, there are a number of ways to do it. There are differing approaches, and many organizations do good work trying to do various aspects of improving healthcare. We take a systemic approach versus a piecemeal approach, which I'll get to shortly. We focus very much on the geographic area where we serve, as well as the particular disciplines of healthcare that we serve and support. We believe in local control versus imposing any kind of superior guidance. Again, that's the maximum local direction that I referred to in the mission statement slide. We are great believers in sustaining the commitment versus providing occasional support, sort of a jetting in and dropping in and doing good work and then moving on. Our commitment is now plus 24 years. And it has proven to be not only a successful thing to do, but the right thing to do. And of course, we believe in developing local expertise, Haitian solutions for Haitian challenges, versus importing expertise on an ad hoc basis. Now, the systems approach that we like to work with involves, and wiser heads than mine have shared this notion with me, that an organization like Konbit Sante can provide staff or support staff. We can provide stuff, medical equipment and supplies, or we can provide space, which is to say, treatment facilities. The glue that holds all of these things together, if you like, is the expertise of data management and process improvements. Without the glue, things are somewhat siloed, and the impacts will be lessened. So we're great believers in this critical management, data, and process improvement section. Not to quote with any kind of reverence, the great or legendary Jack Welch from GE used to say, you can't manage what you can't measure. And there is a certain amount of truth to the matter that you have to know what you're dealing with. But data collection, data management, business planning support, research methods, accountability and metrics, and knowing exactly what we have on hand and whether it's working or not, these things all contribute to healthcare outcomes using data management and process improvements. Of these, today we're going to be focusing on research methods and professional development for staff at the Justinian Hospital, and we'll hear a lot more about that in the coming presentation. So without further ado, I'm going to stop sharing my screen and turn the presentation over for an introduction by my colleague Tetsuta Nagase, who is our country and program director for Konbit Sante in Cap Haitian.
Thank you, Perry. It's my pleasure to introduce our presenter, Dr. Erica Felker-Kantor. Dr. Felker-Kantor is a social epidemiologist currently serving as a senior research advisor at Population Services International and an adjunct assistant professor at Tulane University School of Public Health. In addition to her professional roles, Dr. Felker-Kantor is deeply committed to education in the healthcare sector. As a dedicated volunteer with Konbit Sante, she's taught a course on research methods for residents and staff at Justinian University Hospital, one of our 4 partner facilities, for over 2 years. Her contribution aligns perfectly with our mission at Konbit Sante, where we believe that quality healthcare stems from the effective use of data. We're also deeply committed to ensuring that Haitian health professionals are empowered with the skills to harness data to improve healthcare. Today, Dr. Felker-Kantor will share her experiences working with health professionals in Northern Haiti to improve health outcomes using research. Please join us in welcoming Dr. Erica Felker-Kantor.
Thanks, Tetsuta. I'm going to share my screen. So thank you so much. I first want to thank Konbit Sante for inviting me to present today, and just for allowing me to be a contributing volunteer over the past couple of years. Haiti is very near and dear to my heart, and I'm always looking for opportunities to continue to support the country. Before I start, I just will give you a brief background of myself and how I sort of became part of the Haitian community. As Tetsuta mentioned, I have a doctoral degree in social epidemiology, and I first started working in Haiti in 2010. I received a fellowship to learn Haitian Creole for 2.5 years, and then did spend a lot of time doing research in Haiti, as well as working with the CDC post-earthquake, and worked at a couple of different hospitals in Haiti as well. And I knew of Konbit Sante when I was doing my master's degree at Johns Hopkins. I think one of my professors, Dr. Perry there, had introduced us to Nate, who came and gave a presentation on Konbit Sante. So I was always aware of the organization and their approach, which was something that I was really in agreement with in terms of their approach to sustainability and systemic change, and really having Haitian-led sort of solutions to improving health services and healthcare delivery. And so today I'm going to talk to you about the research course that we've been doing for the past couple years, and how we've tried to structure the course and use some of the findings that we've generated to inform interventions, and to sort of disseminate results in hopes of making change. So before I begin, I just want to go over a little bit about what is research and why is it important for helping to improve health. So simply, research is really just a process of systematic inquiry, and it's really critical for improving patient outcomes and the quality of healthcare. It helps us determine sort of the best practices and treatments for different health conditions. Through research, we're able to sort of identify and understand risk factors for certain diseases. We're able to understand better ways to care for patients, how we can incorporate prevention strategies for certain health conditions. It allows us to communicate information about specific conditions and treatments. And ultimately, it really helps us identify ways to improve the quality and effectiveness of healthcare by generating new evidence. And that's sort of the bullet that we have focused on in our research course. Sort of one branch of research is quality improvement research. And this is the type of research that Konbit Sante has done traditionally, because it really focuses on using measurable improvements it really focuses on doing research that can be used, and that results can be used to inform changes within a health system. And so when we define quality improvement research, we define it as sort of a continuous and ongoing effort to achieve measurable improvements in effectiveness, accountability, and other indicators of quality and services of processes to achieve more equity and to improve the health of the community. So this is the type of research that we really like to focus on, because it's tangible and it's actionable. So we developed a research course. Actually, I should say that before I started, I know that Nate and Pezita had already done a research methods course, and then have helped work with me to sort of develop this course. And the objective is really to provide the medical residents and faculty from Justinian Hospital and our partner clinics with a foundation to develop and implement a research study designed to improve health services and care delivery. And the topics covered really come from a basic research course that I've taught at the university level to graduate students. And it covers all different types of topics that you need to have a basic foundation in order to develop a study and to implement it. And so this may include sort of first identifying what is the problem that we're trying to solve or to understand, and then formulating sort of our question and hypothesis around that problem. And then, what evidence or what already exists within the literature, and then understanding what types of methods could we use to collect further information on this problem and to answer our research question. And then we have some more sort of technical areas, including sort of study design, sampling, the development of the different types of tools to collect the data, how we go about managing and analyzing data. And then ultimately, really what we're interested in is the so what. So then once we have this data, what can we do with it? How do we disseminate the results? And how do we really take these results and use them to inform some sort of policy, or to advocate for funding, or to implement a change within our systems, the hospital systems. And so how we've structured it is that students are really, we group them into teams based on sort of their research interest. And then we have them really go through this entire process of developing and implementing their own research study. I found that, in Haiti, in medical school, it's very focused on clinical skills, and there's not often opportunities for students to really explore other areas that are associated with medicine, epidemiology, as well as to build other skills, like research skills. And so I think one thing that we try to do with this course is to provide this continuing education and opportunity for Haitian medical professionals to learn, and hopefully then to apply what they've learned within their professional lives. So in 2022, we had a group of students, and this is sort of here, I'm going to outline some of the studies that we've done. And so one of the studies that we did was really trying to understand what factors were determinants of mortality among newborn premature babies. And this study just used medical records. So we had medical records data from 2018 and 19 from the hospital. And so again, it's using data that's already existing, that, typically we would like to have this data constantly being analyzed so that we can examine trends and really identify the factors that are associated with mortality. And so the residents helped extract the data and create a database, and we identified the key variables we really wanted to study. And then we did some basic analysis to really identify the factors associated with mortality among newborn premature babies. This year, the course is still ongoing, and we have a couple projects that are currently collecting data. One is that within Justinian Hospital, some of the physicians really wanted to understand why parents of children admitted to the pediatric unit leave before they receive the physician approval for discharge. And so oftentimes they're seeing parents are taking their children out when their child hasn't finished a treatment course or hasn't received approval to be discharged. And so they're using both primary data collection, a survey through which they ask some questions to the parents, and also linking that to some of the medical records of the children, to just examine the reasons why parents are withdrawing their children from care before they're medically approved. The next study that is currently also collecting data is at our partner site at Serving Sante in Limbe, and this study is really interested in two things. One is really to understand more about what women in the community know, what are their behaviors, attitudes, and practices around cervical cancer screening. And then also, really, they want to know why women are seeking cervical cancer screening at a late stage. So a lot of women are coming and they already have an advanced stage of cervical cancer. And so understanding, why they've waited to seek screening. And again, this study is using primary data collection, a survey, and it's also using the medical records to answer those two questions. In terms of sort of what's been found so far, with the course from 2022, again, just as a reminder, we were looking at sort of structural or systemic factors within the hospital that were determinants of mortality among newborn premature babies. And the study found that having a nurse at delivery, CPAP availability, oxygen availability, electricity, incubator availability, these were all significantly associated with mortality. And so Tezida and the teaming, Konbit Sante's team, took these results and have really used them to help inform the use of resources and interventions. So recently, Konbit Sante has hired nurses and helps pay some of the salaries for some of the nurses employed by MSPP. And this sort of action was really in response to the finding that the absence of having nursing staff at delivery was associated with newborn premature baby mortality. And so again, this just shows that just a simple analysis of routine data from the hospital can really be informative. And then Konbit Sante and we can solicit funding to help us really implement some small changes, hiring of nurses that can be at delivery is one step towards helping to mitigate newborn death. And then Nate and Tezida and others have implemented sort of a system of mortality review. And so they look at all the pediatric deaths, reviewing charts, as well as, the different factors associated with, and they've been doing this for years. And similar to our study, they found that electricity was a big issue. When there's no electricity, it makes it really hard to implement care. And so again, they took this result and they've used it and were able to get funding for solar panels. And so now the pediatric ward has solar panels, and so it can function even when there's no electricity or no gas. And so again, these are just two examples of how some basic analysis of routine data and doing some sort of quality improvement research can really help lead to tangible improvements within the health system. For our current course, the cervical cancer study has collected around surveys from around 400 women, which is amazing. And soon we'll begin the analysis, and just through communications with Dr. Nelly, who's leading this, we're hoping that the findings can really help us sort of create some educational materials or, some communication sort of campaigns that the clinic, and they have a mobile van as well as community health workers, can really help sort of disseminate or implement within the local communities and within the hospital for women who seek services, and really sort of encourage early screening for cervical cancer. And we're also hoping that some of the results could help us sort of develop further into other studies that we really want to understand more around cervical cancer. And then this study on the patients leaving without medical approval, we're still collecting data. And once that study concludes, we'll analyze the results and present them to hopefully the medical director and administration at the hospital with potential strategies that could help us sort of minimize this problem. And a very easy solution could just be to have more consistent communication to the parents on sort of why it's important for them to stay through the treatment and to wait to have the approval for discharge, as well as potential ways maybe to subsidize care, or if it's more about space, because sometimes there's not enough space in a hospital for the parents to sleep. And so maybe there's a way to create an additional space where families could stay while their child's in care. So these are just, again, examples of how we hope to use these results to create some sort of change within the health system. So in terms of my reflections so far on the course, I think, as I mentioned, there's a great eagerness among Haitian medical professionals to learn and to advance their skills. In the US, doctors have to, not medical professionals, not just doctors, but nurses and others have to do continuing education credits, right? And have opportunities to engage in research and go to conferences. And oftentimes, you know, medical professionals in Haiti don't really have that. And so I think there's really, you know, a desire to gain more skills and to have that opportunity. And so hopefully this course is a beginning in terms of providing them that opportunity. I think some of the challenges are really around, you know, some of the changes strategies or changes that we may come up with in terms of improving systems. You know, it really may require cooperation at a higher level from, you know, managers and directors of hospitals. And so I think maybe sometimes there's this uncertainty around what is our actual ability to create that change. I think, you know, these are all doctors and nurses who are working full time. And so, you know, obviously it's challenging for them to have time to participate in these extracurricular courses, you know, and often there's not an incentive to do it when they have so many other competing priorities, you know. We have internet issues, you know, connectivity, there's lack of equipment. So not everybody has, you know, tablets for data collection or computers or statistical programs for analysis. And that can make some of the more hands-on sort of engagement challenging. And as we all know, you know, Haiti is currently in a very difficult, challenging time with the political and civil sort of unrest and situation. And, you know, participating in a research course isn't always the first priority when you have so many other more pressing issues happening, and that's completely understandable. I would say in terms of our needs, you know, I think there's needs to have more resources for more engagement on the ground, for more training and support, as well as just more need for resources to provide more opportunities for professional development for our Haitian colleagues. In terms of potential for growth, I think there's a lot of opportunity here to create, you know, more of a learning or research center that provides courses not just on research methods, but on a wide range of subjects that sort of our Haitian colleagues may find applicable. And I just listed out some ideas that I have here based on some courses that I've delivered in other settings with medical professionals. But of course, we have our clinical training courses, and I know Konbit Sante works with a number of physicians across the US and in Haiti to provide those courses. And some other, you know, ideas is continuing with research and epidemiology, you know, how to do this data analysis and manuscript writing so that it can be done, or at least the data analysis can be done routinely. There's some great curriculum that I have around leadership and management in public health, also community engagement and collaboration, working, you know, how to deal with public health emergency response and preparedness within a health system, and then sort of operations, you know, in public health management, laboratories, cold chains, that sort of thing. And so these are just some other ideas that I have if there was, you know, if there was a need for them, if there was sort of an ask from our colleagues, as well as funding and time to put these courses on. So I guess that's, in conclusion, I just wanted to say that, you know, the examples I've provided really just sort of show you how some basic quality improvement research can really help us understand the situation and to advocate for funding to help make even small changes. You know, adding personnel, adding nursing staff can really make a difference. And we're actually now trying to track we'll be tracking sort of the deaths, the pediatric ward, sort of newborn deaths over time now, since they've implemented the intervention of the nurses. And hopefully, you know, we'll see that that go down with the addition of the more staffing. And so again, there's a desire for more learning opportunities. We have started to build some evidence of this quality improvement research findings and started to utilize the findings to solicit funds and sort of create interventions to address some of these identified gaps. Even if it's at a small scale, that's sort of what we've started to do. And again, there's sort of a need for ongoing support, whether it's human resources or other people who want to teach courses, as well as financial support to create a larger learning center that provides students with the materials and sort of motivation to carry out their projects. And with that, I think I am done, and I'm happy to take questions or to have a discussion with the remaining time.
Erica, thank you very much for that. That was just excellent and provocative, I think, in all the right ways. At this point, if anybody has questions, I feel you should feel free, please, to click on the chat icon on the bottom of the screen and pose a question in the chat, and we'll do our best in the remaining time to get to as many of these as we can. While people are typing, I will exercise moderator's prerogative and maybe try to kick things off a little bit. And I wonder if you could, what type of, answer this sort of context setting question, if you like. So what type of technologies would be required or optimal for residents participating in this program? Is it all done on mobile? Is it all tablet-based? Can any of it be done at a sort of a PC workstation if there was sort of a fixed place, or does it have to be done on the go, so to speak?
So actually the courses that I've done have all been remote over Zoom, just because it was during COVID. And then currently now with the situation in Haiti and the limited ability to travel. And I think Zoom can work. I think it would be great to have some more in-person sort of learning, especially around more of the technical components around data analysis and sort of hands-on. I think if someone's there, it's more likely that students will come because you can sit down with them and really work with them to develop out their ideas. But in terms of other sort of equipment, I think, yeah, I don't know. I think if there was a way at Konbit Sante, even just to have a little bit of a workstation with some laptops that had, Microsoft on there, and even some of the basic analysis programs for data, that this would provide a space for the students to come and to work on their projects. And, we could create even like a stock room with, if we need tablets or voice recorders for data collection that we could store at Konbit Sante, that when people do have to do projects, they could use that. I think, also if we're able to create some sort of database, I think to help Justinian or just in Konbit Sante to have a database where we have all this data that can be routinely analyzed, I think would be another big contribution. Because so much already exists, it's just not being looked at, because it's so much is on paper files, and that makes it, hard. And so if there's a way to make that more systematized, and I think if there's, again, if there's opportunities, I know some have really expressed wanting to go to a conference to present some of their work or to write a manuscript. I think if there's, time and support for them to do that, even if it's a small financial support or, time for them to attend a course or something to help them do that, I think that would be great.
Well, let me ask this if I can, because it's been said that Newman abhors a vacuum. So I don't want there to be a moment where we can't get the benefit of your expertise and ideas. So have you found notwithstanding the current challenges that you alluded to, the political instability and the civil unrest and so on and so forth, has there been a continued interest on the part of the residents? Does there continue to be engagement, and how has the current environment of, I'll say, the last 6 months affected things?
Yeah, I think so. Our course, I'll start with our course in 2022. I think that was very continuous engagement. It was with at least the group that I was working with was 3 residents and then Dr. St. Fleur, and we met regularly, I think almost every week to develop. And they, the residents obviously made time and they came and they extracted the data. So that went really smoothly. I think this year it's been a little bit more. I think the first, 6 months or so with the instruction went really well. We had a lot of attendance, and then I think now with the data collection part's been a bit slower, partially due to just all of the issues that are happening on the ground. And I think also just, doing primary data collection takes time and also personnel. I think it's amazing that Dr. Nelly has already done 400 surveys, and so now it's about doing analysis. And so I think that's hopefully I'll be able to work with her on that, either if I'm able to come or on Zoom. We talk a lot on WhatsApp. And I know the other participants, they constantly WhatsApp me as well, to talk about, next steps and trying to keep things moving. I know there is continued interest, especially among several of the participants, in terms of making sure that we finish these projects and really try to get the findings out there. So I think things just move maybe a little bit slower in this context.
You alluded to the interest on the part of the residents and perhaps doing some publishing of their work. How is that something that we can foresee happening? Given the data that's been collected thus far, what more inputs from Konbit Sante and from our supporters and so forth might be helpful in that regard and helping to move that to the next stage?
Yeah, I think it's definitely possible. I think with publishing, it just takes time and someone who's going to lead that process. And so I think that's where we may come up with a little bit of challenges is the time for someone on the Haitian. I think for them to really learn how to do it, instead of like me leading it or Tezada or Nate or someone, we really need the students to actually lead that process, and we can provide them sort of mentorship and coaching and with the steps, but they should really be the active sort of participant in terms of leading the writing process, so that they can really learn how to do it instead of us just doing it for them. So I guess it's kind of initiative on their side, but I think we're all here to help them with that and to guide them on that process if they'd like. And I know Dr. Nelly is planning to submit to a conference. Hopefully in November, we would be submitting maybe an abstract to make a poster, which I think is definitely feasible to do based on some of the data she's currently collecting.
And for those that may not be aware, Dr. Nelly is Dr. Nelly Osiris, who's at serving Hospital Serving Sante in Limbe. So one of our 4 partner institutions. Are there further questions?
Comments? Not a question. So Erica, you mentioned that we've used data from previous research studies to implement changes. Most recently, the hiring of the nurses, supplementing pay for existing nurses. And you also mentioned that we're about to start tracking the impact of that intervention on care, on quality of care and outcomes. I think that might be a really good opportunity to publish something with Dr. Muscadin and perhaps even one of the nurses leading that effort. I think there's a lot that we have to say and a lot we can share about our experiences using data to implement something very concrete, seeing how that impacts care.
Yeah, definitely, because I think that's a great idea. And I think if we can get our measures, like our database in place to start gathering that data, as well as extracting it from before the intervention, then we would be in a great place to have some sort of implementation kind of research study to present and have as like a case study that we could write up.
Exactly. we'll be meeting tomorrow about that. I'm looking
Yes.
forward to it.
Yes, I have made an Excel sheet already.
Great, great. Vic has his
Oh,
hands up. Dr. Herson,
yes.
sorry.
Yeah. Go ahead, Dr. Herson.
Yeah, can you hear me?
Yes.
Yes, thanks. You may have preempted me, Teza, with that comment, but as you know, we're planning to do we're meeting to plan the training course for the nurses, the newly hired nurses, and I'm wondering, Erica, based on your data, where you would what you would place as the highest priority in terms of nursing training.
Actually, I think Teza might be better placed to answer that, but I do think, I think it would be great if we have some sort of measurements for that training course that you guys are going to do. Like, even if it's like, and you may already do this, like pre and post kind of tests, as well as some key indicators that we want to look at before and after that training that really align to what that training hopes to address. But in terms of like the current needs or what around the nursing staff, I think Teza probably has a better idea of that. But I think that is a great question. We want to make sure we're filling those needs.
It's certainly a need, and it's been shared or expressed by the nursing chief, by the head of the service, by Dr. Muscadin, who many of you know is a faculty there. I think it hasn't been expressed as a need up to now, Vic, Dr. Herson, because there have been so few nurses in the service. Now that there is a, strong, stable cadre of nurses, now we're moving to, okay, these nurses need training on, or would benefit from training on neonatal care, on neonatal resuscitation. So that's what we're moving towards now.
So
did that answer your question?
Yeah, I think let me ask a follow-up.
Okay.
One of the barriers that I think that I found in on site has been sort of some of the culture of care and hierarchy of care. So I'm wondering about the role of the nurses, and would an expanded role of nurses, for example, going to deliveries and being the primary person to resuscitate a baby, would that be an acceptable model, or would that be seen as a variance in the usual role of a nurse in the Haitian health system?
So I had a conversation about this with Dr. Osias, who's a faculty member here at Justinian in the maternity, in the OBGYN service. She said that the maternity nurses, the midwives in particular, are interested in participating in that course. So I think they certainly would be interested and be willing to take a lead in the kind of care that you're referring to. Whether the pediatric nurses would be as eager to step into that role is a question for them, and one we can have. This is all discussion, and we're all kind of working and learning and changing together. So this is something we can pose to them and to the head of the service and the nursing chief.
All right, then. Well, what I would like to do, if I may, is to just sort of tie a bow around things, and at the risk of putting too many slides in front of you, I'd like to go through just the last three before I kind of close out the proceedings for today. So in the prior slide that I showed, I talked about the constituent aspects or building blocks, if you like, and the role of Konbit Sante in data management and process improvements, which we heard so much of from Dr. Felker-Kantor today. But of course, Konbit Sante is empowered by the donations and the foundation support and the grants and the medical supplies and expertise that so many of you and others provide to kind of stoke the furnace, if you like. We've heard about the importance of stuff and how the solar panels help to provide reliable electricity, which is an outcome of the research, which underscore the importance of reliable electricity in health care outcomes. Where we recently had a tour of the Justinian Hospital with a biotechnician He, among other things, commented on the condition of the floor and how a better surfaced floor would reduce dust and reduce breakage of small items that are dropped. And of course, we've talked about staff and the addition of nurses and so forth, and how this is so critical. All of this has to be bound together with the data, the management input, and process improvements that we've heard about today. There are many ways that you can help in addition to assisting us in securing the aforementioned staff stuff and space improvements, and working with us to see that we can continue to implement systems change. But we also would certainly want to encourage people to refer friends to us, and above all, not to give up on Haiti and the Haitian people. I think most people on this call today are very aware and very keyed in to the challenges faced by Haiti and the Haitian people, but also upon the extraordinary resilience of the Haitian people. It's something that we just try to underscore for all those with whom we come in contact. We recently received a very nice thank you from a family whose child was treated at the Justinian Hospital. I'm sort of humbled by this, not only because of the sentiment, but that they took the time to thank us, to thank the staff at Justinian, I should say, even as their child was ill and recovering, to underscore the importance of compassion and kind care in the way that it makes a difference, not only for the patient, but also for the family. So we are welcoming everybody to join our Konbit. You can see some of the all-stars there. And longtime Konbit supporters may note the presence in the right foreground of Dr. Ronnie Saint-Fleur, who was for many years a pediatrician at Justinian University Hospital. So we welcome everybody to join the Konbit and get on board, and to encourage us further and to support the Haitian people and the communities with whom we work. So with that, I'll just refer folks, if I may, to our website at konbitsante.org. Any questions, please just send us a note at info@konbitsante.org. And of course, we'd be very happy to engage with you and see how we can work together to continue to improve the lives of the communities we serve. Any further questions, comments? Great. Well, the last thing that I'll say, I keep saying it's the last thing I say, but this is the last thing I'll say, is that a video of this presentation will be up forthcoming within the next several weeks. And we will make the link to the video available to those who attended, and of course, those who are unable to attend this afternoon. So thank you so much for your attention this afternoon. Thank you, Erica, for the presentation. And I wish everybody a pleasant day and good health.